Hi, I'm Dr. Joseph Witt-Doerring, and the purpose of today's video is to talk about two serious side effects which are not described in antidepressant labeling. The two side effects are post-SSRI sexual dysfunction, and then also uh, kind of protracted withdrawal, but the antidepressant version of that. So to give you a little bit about my background, I'm a psychiatrist. I have a specialty in adverse drug reactions for psychiatry. I've worked at the FDA. I've worked at several pharmaceutical companies looking at drug safety. And it's essentially what I do mostly in my clinical practice now is help people recover from side effects of psychiatric drugs. So jumping straight into it. So the first one is the post-SSRI sexual dysfunction. Now, pretty much everyone who starts one of these SSRI medications, like your Prozac and your Lexapros, or the SNRI medications, will have a degree of sexual impairment that arises pretty soon after starting the medication, within a few days, and it's usually described as lower libido, some lack of interest in sex, maybe difficulty maintaining an erection or lubrication, and so this is usually something that's very prominent, and a lot of people who take these medications are aware of it. But it's usually something that goes away. So by and large, the majority of people, after they stop the drug, this will peter off over the space of a few weeks to sometimes it can go on to about 3 months or so before full function emerges. However, what we have been seeing in the literature, and there's been a lot of reports about this, you just have to go on YouTube and search PSSD, and you will see that a lot of people are complaining about persistent sexual dysfunction after stopping these medications. There's been big case reviews on this online. Professor David Healy has published, I think, 500 of them or so. And yes, so while it's not in our FDA drug labeling, in my perspective, I think it is legitimate because I compare it to other, permanent neurological problems, which we see pretty frequently in our practice. We have things like the people with the permanent neurological damage from the benzodiazepines, now acknowledged in drug labeling. You can have permanent movement disorders from the antipsychotic medications. So there is kind of already a number of similar medications which acts on the brain, which in a rare and small proportion of people seem to cause persistent problems. So to me, it is not a stretch at all that a drug that causes, sexual dysfunction in the majority of people who take it can, in a certain select few, cause these problems to endure almost permanently afterwards. I've heard this described by Professor David Healy as, in some patients, a degree of genital anesthesia, which goes to the level where, someone might put something spicy, like a kind of a chili paste down there. I know you probably would never do that, but they haven't been able to feel it. So we're talking about extreme anesthesia down there. Interestingly, this post-SSRI sexual dysfunction can come along with a lot of emotional blunting, so people feel a lack of emotions as well. And those two things may go hand in hand. They may be part of the same underlying biological process that's leading to the sexual dysfunction. So one thing that's not in the labeling, which I think is important to know. The other thing is the persistent withdrawal symptoms. And so oftentimes when people come off antidepressants, there will be a period of a couple of weeks to months where they will have, brain zaps when they're coming off. They'll feel more anxious, maybe more irritable. They call it the discontinuation syndrome. Usually this resolves and it goes away, but again, what we're seeing more of is people who have persistent problems, which are completely different to the problems where they that originally got them on the medication in the first place, enduring afterwards. And when I say they're completely different, we've had, I've consulted on cases where people have had serious burning sensations all over their body to the point where it was just unbearable. And the causal linkage to this is that they were doing fine, they stopped their medication, and then they just had this flare-up of neuropathic pain. And there's something about, and so again, This is really similar to the benzodiazepines. And, when there's a small proportion of people who stop these medications and they go on to have a whole bunch of really uncomfortable neurological problems, which you can see in other videos in my channel. So, okay, so those are the overview of two really pretty debilitating conditions that can arise if you're unlucky if you're taking these medications. And I wish I could quantify it. I wish I could tell you this is something that's happening in 1 in 10,000 people, or it's something that's happening in 1 in 100,000. It could be anywhere in between there. The thing is that these medications are so frequently used that, when we find 100 cases online, it could be 1 in 100,000. It could be 1 in 10,000. We don't know how many people are really reporting this stuff, and that's just a limitation of collecting post-marketing safety data. So does this mean you should never use these medications? I think not. I think these things are rare, but I think it's important to be informed about them. I think it provides a caveat that you should not use antidepressants if you're not having really significant anxiety and depression. If this depression and anxiety is not getting to the level where it's really impairing your function, you may want to steer clear of this 1 in 10,000 to 1 in 100,000 risk. It may just not be worth it for you. It may make more sense to go and do psychotherapy and try other means. So I hope you enjoyed this video. I hope it's been informative. And yeah, thanks for your attention.